fasciitis is one of the most common causes of heel pain, and it can be very frustrating to have because it can prevent you from walking, running, dancing, and even working, especially if you're on your feet for a long time. What is up, everyone? It's Dr. Everyday Jan. My goal on this channel is to educate you and help you make informed decisions about your health. The plantar fascia is a thick fibrous band of tissue that starts at your heel and runs across your arch. The purpose is to not only support the arch of your foot, but also to absorb the shocks anytime that you're walking, running, or just putting any weight on your foot. The reason that it hurts is if you do a lot of running, standing, or walking, and you have inappropriate mechanics, this can put a lot of extra repetitive stress on the plantar fascia, which can then lead to micro tears and chronic inflammation at the heel. In the past, it was thought to be an inflammatory process, but now it's thought to be more of a chronic degenerative process where the collagen fibers get disrupted. So whenever I see a patient in clinic, my goal is to first figure out what is the actual cause in the first place. Because if I can figure out what the cause is, then the treatment will be much more directed towards that and it will be so much more effective. There are many factors that can lead to this increased tension at the plantar fascia, and you might have several of them. If you have flat feet, that causes your heel to turn inwards and your foot will point outwards when you're walking, and that puts a lot of extra stress on the plantar fascia. If you don't have flat feet, but your foot is still turning outwards whenever you're walking or running, that's still going to put a lot of stress on the fascia. If you have a higher arch than normal, that causes the plantar fascia to tighten and the foot can't absorb the shock like it's supposed to. Also, if you're obese or overweight, that also puts extra stress on the fascia. Now, tight calf muscles and tight Achilles is a huge contributing factor to plantar fasciitis. It's actually the most important independent risk factor. Runners and ballet dancers are very predisposed to this because they're constantly using their calf muscles, and that causes the calf muscles to become tight, which then causes pain at the plantar fascia. If you have weak muscles either in your foot or your calf, that's going to lead to improper mechanics and then again put more stress on the fascia. Also, think about your environment. Are you walking on a hard surface? Are you barefoot all the time? Or do you have poor footwear such as dress shoes that have very poor cushion on it? Every single time that you walk or put weight on your foot, your fascia is taking a hit, and if you don't have good cushion underneath, that can be very painful over time. There are certain things that are consistent with plantar fasciitis. For example, your pain might be worse in the morning when you get out of bed and you take your first initial step. You might find yourself walking on your toes first because it hurts to walk on your heels. Also, if you've been sitting for a long time and then you start to stand, and you feel pain on your heels, that might be consistent with plantar fasciitis. Or if you're on your feet all day at work and at the end of the day your heels hurt, that's also consistent with plantar fasciitis. And it doesn't have to be in just one foot, it can affect both feet. If you see a physician, we'll ask you some questions and also do some examinations. But you can do some of these at home. One of the tests that we do is we press firmly on the heel where the bony origin is under the calcaneus. And if that reproduces that pain that you feel when you wake up in the morning and take your first initial step, then that's pointing towards plantar fasciitis. Also, if you point your foot and also your first big toe towards your body and that reproduces your pain, then that's also a sign that this could be plantar fasciitis. If this sounds like it's lining up with what you're having, then usually lab tests like imaging and blood work is not needed. The only time that imaging and labs would be done for plantar fasciitis would be if something else is suspected. Plantar fasciitis itself is a clinical diagnosis, and you do not need an X-ray, MRI, or anything like that to make the diagnosis. X-rays look at bones, so it can be helpful if you're looking for maybe there's a fracture or arthritis. And if you do get an X-ray, there's a chance that you might see a bone spur because 50% of the people who do have bone spurs do have plantar fasciitis. Bone spurs occur due to prolonged tension on the fascia. However, lots of people do have bone spurs but do not actually have pain from it. So the bone spurs itself do not actually cause plantar fasciitis, and you do not need to remove them in order to successfully treat plantar fasciitis. Advanced imaging such as ultrasounds and MRIs are not needed for plantar fasciitis. However, they might be done if you fail treatment, which I'll go over later, and you're considering doing like an injection or even surgery. However, most people don't need to go to those steps. Blood work like labs are not usually done. However, sometimes plantar fasciitis can be associated with systemic autoimmune arthritis, such as seronegative spondyloarthropathies, and those can be associated with a certain blood work called HLA-B27, in which case that would be checked. if you go see your primary doctor, there's a good chance they'll recommend the things that I'm talking about and also refer you to physical therapy. So let me just talk about some of this stuff so you can be prepared, know what to expect, and maybe even try some of these yourself. In the initial beginning stages, you need to give your foot relative rest. Now, I know you athletes hate to hear that because it's really disruptive to your routine. You love running and resting is the last thing you want to hear. However, you need to give your foot a break. If you keep on running and dancing and doing whatever that's causing your pain, that's going to keep causing microscopic trauma and tears to your foot. You're not going to allow your foot to heal. So if you're a runner, consider cross training, perhaps doing something like biking to maintain that aerobic fitness while still giving your heel some rest. You can also use some oral pain medications like anti-inflammatories and Tylenol for pain relief. However, these should be used only in the short term. You don't want to be using this long term because it can cause damage to your kidneys and also your liver. If you have stomach ulcers, heart disease, kidney disease, or platelet disorders, then hold off from using anti-inflammatories and consider Tylenol instead. Also, there's different types of anti-inflammatories and some may be better in different situations, but I'll save that for another video. So don't forget to like and subscribe to this channel. Another thing that you're going to want to do in the initial phases is ice massage. So you can use a water bottle, put it in the freezer, and when you take it out, roll it underneath your foot and plantar fascia, and that really helps loosen up that fascia, break up that scar tissue. Another thing that can be very helpful is orthotics and modifying your shoes. If you have flat feet or high arch, getting some orthotics can really help put less stress on that plantar fascia. Now, there's different types of orthotics. Some of them you can just buy over the counter and some of them are custom. The custom ones are more expensive. They take a mold of your foot, and actually it's been shown that the custom ones have not been more helpful than the over-the-counter ones. Now, this is not a medical recommendation, but personally I'm a fan of Super Feet, and you can buy those on Amazon. My husband is a physical therapist and he has flat feet and they really work well for him. So with shoe inserts for plantar fasciitis, don't waste your money and don't get the custom ones, just get the over-the-counter ones from Amazon. Super Feet has different types which has different levels of arches, so you may have to try different ones to find which works best for your feet. If you have a normal arch, you may consider using like a silicone or rubber heel cup just to put some extra cushion underneath that plantar fascia. And if you have bad footwear such as dress shoes like flats or high heels, those typically don't have a lot of good support. So if you have to wear those shoes for work, bring an extra pair of good shoes with good support so that we can change into those. Another thing that you can try is using a splint at nighttime. The splint keeps your foot in mild dorsiflexion, and that keeps your plantar fascia in a mild stretch, which helps with pain. However, these can be a little bit cumbersome, so it may take some time to get used to. Now, if you see your primary care doctor and they think you have plantar fasciitis, they're going to refer you to physical therapy. Usually it's anywhere from 6 to 12 sessions, sometimes even less. It really just depends on your insurance. I'm a PM&R doctor. I specialize in this, so I'm going to go over some of these exercises that you would do if you were going to see a physical therapist that you can try at home too. First off, you got to loosen up the tight foot and calf muscles and the plantar fascia. Use a ball like a lacrosse ball and just roll your foot over it to help break up that scar tissue. You can also use a frozen water bottle and roll your foot over that like I mentioned earlier. Another option is you can use this ice ball. I got this from Amazon, and you can manually roll it over into your foot. Do this for 1 minute and repeat it 3 times. Next, it's very important to stretch the plantar fascia. Sit with one leg crossed over the other and pull your toes and your foot towards your body. You should feel a nice stretch in your plantar fascia. Hold this for 30 seconds and repeat it 5 times. Next, you can stretch your calf and your arch by using a towel. So you can do this either in bed or on the floor. Use a towel to help point your foot and your toes towards your body. You should feel a nice stretch in the calf and also the fascia. Hold this for 30 seconds and repeat it 10 times. This is best to be done before bedtime and also when you wake up before you get out of bed. Next is a standing calf stretch. Find a wall and with your forward foot, keep your knee bent, and with your back foot, keep your knees straight. Bring your hips towards the wall until you feel a nice stretch in your calf. Hold this for 30 seconds and repeat it 10 times. A more advanced calf stretch is to do it on a step. Find a step or use a stair. Put your tippy toes on the step. Slowly lower your body down until you feel a stretch in your calf. Don't forget to hold on to the railing so that way you don't fall off. Hold this for 30 seconds and repeat it 10 times. Now, once the pain subsides, you want to work on strengthening the muscles because remember, weak calf and foot muscles leads to increased tension on the plantar fascia. So in physical therapy, they'll have you do these strengthening exercises. To work on the weak foot muscles, you can do some toe curls with a towel. So put the towel on the ground and use your toes to curl up that towel, and repeat that 10 times. Next, you want to strengthen your calves. Use a step or a chair, get on your toes, and slowly lower your body down. The key is to go slow and have eccentric contractions, because that is what really strengthens up the calf muscle. Now, if you still have pain after seeing a primary care doctor and completing physical therapy, then that's when you might get referred to a specialist like myself. If you see a specialist, we'd want to make sure that the diagnosis is correct in the first place, because there are other things that can cause heel pain. For example, it might be a nerve issue such as tarsal tunnel syndrome or neuropathy, in which case a nerve study might be helpful. Or you may even have a stress fracture in your heel, or even rheumatoid arthritis or osteoarthritis, in which case imaging and perhaps even labs might be helpful. It can also be something called Achilles tendonitis and posterior tibial tendonitis, which is inflammation of the tendon. However, if it is truly plantar fasciitis and you've tried the treatments that we've already discussed, then this is when we would move on to second-line treatments such as injections. Now with injections, there are different types of injections. Traditionally is the corticosteroid injection. However, doing a steroid injection in the plantar fascia is actually riskier than doing an injection in a joint such as a knee or a shoulder. The reason is because there's a lot of tissue where the plantar fascia is, and the steroid can potentially lead to a plantar fascia rupture or even fat pad atrophy, which would make your pain worse down the line. Platelet-rich plasma, also known as PRP, is actually a better option. It's been shown to have more long-term relief compared to a steroid injection, and it has much less risk. It doesn't have the risk of the plantar fascia rupture. PRP injections include a blood draw. That blood is then injected into the plantar fascia, and that helps stimulate the growth factors and helps accelerate the healing process. However, in the United States, insurance doesn't cover PRP, so it's cash only, and it can be a little bit expensive. Another option is prolotherapy, where essentially sugar water is injected, and it actually works similar to PRP in that the point is to accelerate the healing process. Now, another treatment option that has been used is called extracorporeal shockwave therapy. This is also supposed to stimulate the healing process. However, there have been studies done. Some show that it helped, but there were also a good amount of studies that show that it didn't help. So it's not commonly done, and I actually don't know anyone who does it in my area. The last resort treatment for plantar fasciitis is surgery. In the surgery, they release plantar fascia. However, surgery is really the last resort treatment, because 90 to 95% of people get better with conservative treatment alone. And you really want to give the conservative treatment a really good try, at least for 6 months before considering surgery, because surgery has a lot of risks too. All right, I hope that video helped you guys. Let me know in the comments below if plantar fasciitis is something that you've been dealing with and what you've done to try to help it. Again, if there's any topics that you want me to cover, let me know in the comments down below, and I'll see you guys next time.